in continuation of my previous lecture, previous talk, I am giving some more information regarding cancer cells which are very important, because first thing about cancer is the difference in the cancer cells and in the normal cells. These are very important issues when one wants to know about the cancer, because if you have a cancer, what happens in the body, that cells keeps multiplying, cells keeps dividing, and in the beginning usually what happens, one doesn't feel any difference in his body temperature, in his or her health, except after some time when it becomes very reached to a very aggravated stage. Only at that stage you come to know that you have got the cancer. So these stages of the cancer are named differently by grade 1 cancer, grade 2 cancer, grade 3 cancer, grade 4 cancer, and when it is at the stage 4, then it is very serious, and if the patient and the person goes for the treatment at this stage, it's really very difficult for the doctors to cure. So this is the slide which where I have shown the difference in the normal cells and in the cancer cells, because if one has got the cancer and wants to know if he is suffering from the cancer, goes to the pathologist. So pathologist when take out the fluid from the body, on the basis of the picture of the cell under the microscope or the electron microscope or any other type of microscope which a person use, comes to know that this person is suffering from cancer. So it is, the first thing is difference in the boundary line or in the shape. You can see the pictures in blue are the normal cells, and the pictures in the orange brownish color below that are the cancerous cells. So normal cells, you can see the distinct nucleus, okay, the first picture, and in the cancer cells you cannot see the defined boundary of the cells, you can see the kind of lump. The second picture, if you see carefully, you can see the chromosomes very clearly. So this is another major difference. Normal chromosomes, the scientists who are expert or the pathologists who are expert, they can find out these are the normal cells. But in the cancer cells, chromosomes number sometimes are more or less, and then their shape is also different. They are, some kind of not well defined boundary they do have. Similarly, the normal cells, they do not form any kind of clump. Their boundary are distinct, as you can see in the last picture, but in the cancer cells you cannot see the normal boundary, you can see several cells forming a clump like structure. This is very clear. So abnormal number of chromosomes and arranged in a unorganized manner. Similarly, slowly you will see the claw like extensions and clusters of cells without any boundary. So on the basis of this you can see the another pictures on the cancer cells. This is a picture which shows the in situ cancer and the invasive cancer. So what is the difference in situ cancer and what is the difference for the invasive cancer? Actually, the important thing is that if you see the in situ cancer here, the cancer is deep seated tumor, okay, the present here. But invasive cancer, what is the invasive cancer? Why it is called invasive? Because the cancer cells has a tendency to multiply. When they multiply, they slowly enters the other cells. They don't have a specific boundary, they don't have a specific cells, and slowly you can see the cancer cells all around. This abnormal growth of the cancer cells, it invades the other cells, that's why they are called the invasive cancer. This is another very important characteristic of the cancer cells. So slowly they cover the whole area, and since they overpower the normal cells which have certain functions for the body, these invasive cancerous cells, they don't perform any function properly. Then at this stage, patient comes to know that the person is suffering from cancer because his or her several body functions gets affected. So this is another picture which is showing you the normal cell and the cancer cells. Achha, normal cells, another property they do have which is written below, apoptosis, and cancer cells below one can read the cell continuous dividing. So normal cells has the normal DNA and there is no DNA damage, and after a certain time every cell dies. This is a metabolic feature of a normal body which is called apoptosis, and which has been shown here, where you can see a normal cell with a regular boundary, shape is almost well defined, and after at certain stage this cell gets the signal from the body and it dies. This process is known apoptosis, which is a normal feature of all the normal cells. Remember, it is a feature of all the normal cells. But on the right side one can see a cancer cells. Cancer cell does not have a well defined boundary. You can see inside that it has a lump of chromosomes, not a well defined chromosomes. Similarly, its DNA has been damaged or the sequence of the gene has been changed due to certain factors. It could be anything, it could be radiation, it could be any kind of chemical which we had discussed in our previous lecture, several chemicals which are known nowadays to cause the cancer. So what happens? These cells' metabolic features are lost and metabolism get disturbed, and as a result what happens? These cells continuously divide. There is no check on the division or the growth of the cancer cells. After several divisions, what happens? It gives you a feeling that it is a lump or it is a mass or it is a kind of hard structure inside the body. So another important thing what I would like to feature here is related to these cells. I mean, mentioning about the shape of the cancer cells, that this is cell which continuously divides, and when it continuously divides, especially when we are talking about the cancer and it is an introduction part, you can feel the lump or the mass in the part of body, especially about the females. About the breast cancer, I'm going to discuss giving the reference to these abnormal cells. So usually what the females report or they feel that they can have a kind of lump or kind of some solid structure. So this could be a sign of cancer in the body. So one should go for the mammogram, one should go for the ultrasound, and usually what happens when it grows, what I was talking about, that continuous division of the cancer cells, when it continuously divide or it continuously grows, to what happens? It invades the other cells, and at that stage cancer becomes more serious. And especially the breast cancer I will talk about, because the breast cancer is a very common cancer in the country. And here what happens, when the cells multiply, invades the other tissue, and if it goes to the lymph, so it comes in the blood circulation, then it spreads to the other part of the body. And that stage, if you feel so kind of lump or kind of hard structure in the breast, immediately one should go to the doctor, immediately one should report to the doctor and get this lump or the solid structure or mass of the structure removed from the body. Doctors usually, if you go to the doctor at a very early stage, they are able to remove this uncontrolled divided mass of cells from the body, and this is called a conservative surgery. But if you delay it, or if you don't notice, or if you don't bother about, if you feel some kind of mass or lump in the body, then there are chances that it spreads to the lymph or other parts of the body, and then it becomes what I say, the more serious and becomes out of control. So that's why the shape of the cancer cell, what I have been showing here, what I have been emphasizing, are very, very important, because a pathologist only on the basis of the shape, on the basis of morphology, on the basis of the cluster they form, or if they become aggregated, differentiate between the normal and the cancer cells. So usually it is very common in case of breast cancer. Only a little positive point here about the breast cancer is, since it does not have many lymph tissues or the blood vessels, so if you remove this solid mass of the cancer cells from the breast, then there are chances that the person not only survives but leads to a normal long life. And there are, I would like to mention just one or two more things here, since we are talking about the cancer, and that too the breast cancer related to the Indian females. These are mainly the two types of cancers here which a doctor tells to a female patient. They are called the ER positive and ER negative cancers. Mostly the Indian females have the ER negative type of cancer, and this ER negative type of cancer is more difficult to treat, because most of the medicines which have been developed in the field of breast cancer, they are for the ER positive patients. ER positive patients means the every cell has some kind of growth on the outer side, which are called the receptors, through which it takes anything, whether it drugs or whether it interacts with the outside the world. So if it is ER positive, you have the receptors, you can develop a drug against this receptor. But ER negative patients has a problem because they don't have any receptor. So how a drug goes inside the cell and stops the malfunctioning of the cancer cells is a bit difficult. So ER negative cancers, which are common, about 90% of Indian females are suffering from the ER negative type of cancer. It's more difficult to treat. But once again, I am emphasizing what I emphasized in the beginning, that one need not to be scared. If you are scared, if you think that it cannot be cured, then it is impossible for the doctors also to treat you. So have a very positive attitude, have a healthy lifestyle, have a normal healthy food. If you are going through this problem of the cancer, and as soon as the doctors goes about the treatments, you go for the radiation therapy, you go for the chemotherapy. If one has to undergo the surgery, one has to be psychologically very strong and should not bother about the physical changes which appear in the body due to the cancer. Like sometimes your skin becomes rough, sometimes what happens, you have the hair fall, sometimes you think that outside the world will see you physically and without hairs, and you need not to be ashamed of all these. Okay, these are the simple normal biological process. Okay, if it can go wrong in anyone's body, and we have to psychologically support others also who are facing this problem. With this note, I will end my lecture here. It was an introduction part for your cancer. So like any other disease, treat it as a normal disease. Okay, so once you are positive, once you are adamant, or once you know that you can overcome all these diseases, this cancer part, so you will overcome with all these. I know so many patients personally also, and one can see in the society also. There are many cancer patients who are leading the normal life. They are in the teaching profession, they are in the doctor profession, they are in any other profession, and they are going through a very normal phase. Only another thing which one has to be very careful is routine checkup. Don't miss that and don't skip that. If the doctor advise you routine checkup, so please keep going to the hospital, keep taking the medicine. Usually what happens in the case of cancer, you have to take the medicine whole of your life. So that is like, make it a routine, when and how you have to take the medicine, and if you are taking the medicine regularly, if you are trying and taking a healthy diet, if you are regularly doing the exercise. So I am sure, and doctors also give you this assurance. So one has no problem with this disease, cancer. That was the basic purpose of talking about the cancer here in this introductory lecture. Thank you.